Recording. We got you covered. UrbanBroadcastMedia.com, Chicago. And around the world where your voice is heard. This is UBM Talk. The Voice of Faith Battle and Concert Weekend is going down May 23rd through 25th, 2014 at the Met, 41st and King Drive in Chicago. We are looking for the top 15 soloists and choirs to be number one in their category. Win $1,000, a trophy, and a free recording session at UBM Recording Studios on Friday, May 23rd. Come watch the city's top soloists battle it out, then enjoy a performance by Grammy Award winner Darius Brooks. Saturday, May 24th, let the top 15 choirs put you in the spirit while being entertained by gospel hip-hop giants Gemstones. Our grand finale on Sunday, May 25th will be a night to remember as Walt Whitman of Soul Children of Chicago takes center stage. Also a performance by Kim Stranton. That's right, thousands of dollars to be given away for the winners of the Voice of Praise Battle and Concert Weekend, May 23rd through 25th. Sponsored by Urban Ministries Incorporated, Attorney Ernesto Borges, Inner City Underwriters, City Colleges of Chicago, and PNC Bank. To order tickets or register for the competition, log on to UrbanBroadcastMedia.com.
Doesn't it seem like our society is dominated by social media, gang violence, and a failing economy? Our family structures are deteriorating. Enrichment Parent and Child Center's mission is to provide a safe environment for at-risk families. Our enrichment and empowerment seminars focus on life and parenting skills. Knowledge is power. When you know better, you do better. Visit our website, www.enrichmentpcc.org. Click Donate to join the movement.
Hey, it's Dr. Shanika Williams, affectionately known as the Diva MD, and I'm excited to bring to you the Diva MD Show every Friday night at 8 p.m. So here's a chance for us ladies to let our hair down and discuss topics important to us, including health, love, family, fashion, you name it. My fellow divas, you'll have a chance to call in to get your medical questions answered and join in the discussion. Join me every Friday night at 8 p.m. starting April 25th for Girl Talk.
The following show is paid programming and does not necessarily express the views and opinions of Urban Broadcast Media and its subsidiaries. Thank you for listening to UBM Talk.
Shanika Williams, MD, Diva MD. How you guys doing today? I'm so happy to be back again this week and to hang out with you guys. Are you guys enjoying the weather? If you're in Chicago, today was one of those days. It had to be, 60, 70 degrees outside. It was absolutely gorgeous. I loved it. And I actually had a very cute dress that I bought to put on, and clearly I couldn't fit it. I was kind of upset about this. So I bought this dress, okay, and it is a size, I'm not going to say the size, but I bought two dresses, both the same size, and one of them didn't fit. How was that even possible? Please explain to me. Anyway, that's a whole nother story, but I want to welcome you guys to the Diva MD Show, where you can get some great health information, let your hair down, have some girl chit chat, and just have a good time. I like to start off my show, for those of you who are just joining me, with some words of inspiration or something to get you going. So the words of inspiration today are Exodus 20:12. Honor thy mother and thy father, that thy days may be long upon the land which the Lord thy God giveth thee. Happy Mother's Day to all you ladies. Happy Mother's Day. Happy Mother's Day. Okay, I'm not a mom, so you can still tell me. When people go to the store and you're walking around and you hear and you say you don't have kids, do you say thank you when they say Happy Mother's Day? Or do you say, I don't have no kids? What do you say? I say thank you and just let people believe, that I have kids, but whatever. So honor thy mother and thy father. God said it, my mom, love her to death, love her to pieces. She has dementia, and I've been taking care of her since 2009. If I had not taken my mom, I probably wouldn't be the person that I am today. Working with my mom, with her dementia, you know, it has completely changed me. It's made me a more empathetic person, more compassionate, more loving, more giving, because she can't do anything for herself. She does, you know, she needs assistance with everything, and it just makes me a lot more patient and more appreciative of the life that God has given me. So, you know, please honor your mother on this day. You don't have to break the pocketbook, you know, to get your mom something, but just, you know, show her something that, you know, that shows that you appreciate her and that you love her, and that, you know, she's the one that makes your day and makes you smile. If you guys don't know, you can follow me on Instagram and Twitter at DivaMD929. You can also follow me on Facebook at /DivaMD.discoveryourself. For those of you who don't know, DIVA is an acronym, and it stands for Discovering Your Innermost Valuable Assets. Discovering Your Innermost Valuable Assets. And for those of you who really want to get to know me, knows that my innermost valuable asset is the God in me. But over the course of the past couple of weeks, I've been discovering a few more valuable assets, you know, perseverance, patience, and just loving more. And those are my innermost valuable assets. So if you guys have some valuable assets that you want to share with me, you can hit me up on Facebook or Instagram or Twitter and share those things with me, and I'll comment back and tell you, you know, about your innermost valuable assets. So today's show is actually, I have no guest for the first portion of the show. It is Dr. Williams, who will be having a few things to tell you today. And today we're talking all about preventative health care. Okay, I'm a family practice physician, and that is the bread and butter of my of what I do. You know, my goal is to keep patients out of the hospital. You know, some people say, oh, you know, you're a doctor, you just want to treat illnesses. No, that is not the case. I actually rather you not be in the hospital and not be sick and not have these diseases that, you know, affect you on a daily basis. So, you know, I am going to talk to you guys today about preventative health. So each year, millions of people actually die from preventable deaths. Preventable, right? So some of the leading causes are cardiovascular disease, chronic respiratory disease, unintentional injuries, diabetes, and certain infections and diseases. It's estimated that over 400,000 people die each year in the United States due to poor diet and a sedentary lifestyle. You guys know what a sedentary lifestyle is? Sitting on your butt in front of the couch, eating those potatoes and potato chips and Lay's and all that good stuff. Things that you know, really like to eat. But you're not exercising and you're not increasing your physical activity. So therefore you lead a sedentary lifestyle. So y'all learn something new every day, right? So I'm gonna have you guys take out your pen and papers, because you might want to jot some of this down. I have a lot to cover, and I'm actually going to keep the phone lines closed today. If you have any questions that you want to ask me about anything that I say on the show, you can follow me at DivaMD929 on Instagram and Twitter, and Facebook. DivaMD.discoveryourself, and you can post your questions there, and I promise I'll get back to them through this entire week. Okay, so there are actually many methods of preventing disease. So you want to visit your doctor, right, for regular checkups, even if you feel healthy. You have to do this because you want to do disease screening. You want to identify risk factors for disease. You want to discuss tips for a healthy and balanced lifestyle. You want to stay up to date with immunizations and boosters. And you want to maintain a good, healthy relationship with your healthcare provider. So that's actually why I went into family medicine, because I wanted to actually develop relationships with my patients and not just treat a disease, right? So there are many different ways of prevention. There's primary prevention, secondary prevention, and tertiary prevention. Primary prevention are methods to actually avoid the disease, right? By eliminating disease agents or increasing resistance to disease. So examples of that include immunizations, maintaining a healthy lifestyle, healthy diet, exercises, things that you hear on a regular basis, avoiding smoking, right? Then there's also secondary prevention. So these are methods to detect and address any existing disease prior to the appearance of symptoms. So have you guys heard of the silent killer, like hypertension, high blood pressure? So that is an example of secondary prevention, of actually going into the doctor and getting screened for high blood pressure. Even if you don't have any symptoms of high blood pressure, you get your blood pressure check and it's high. That's the silent killer. So that is an example of a secondary prevention. Then there's also tertiary prevention, right? So these are methods used to reduce the negative impact of symptomatic disease. So you already have the disease. Now we're trying to reduce that negative impact of those symptomatic disease so that we can decrease disability and death. That is prevention in a nutshell. So common diseases, disease screenings include checking for hypertension, checking for diabetes. You want to check your cholesterol, screening for colon cancer, depression, HIV, sexually transmitted diseases, mammograms, colorectal cancer screening, screening for osteoporosis. These are some of the things that we're going to talk about during this segment. I got a lot of my information from the U.S. Preventative Service Task Force, a group of individuals like myself, other physicians of other entities that get together. They talk about, some of these diseases, and, they do studies to try and figure out what's the best way to prevent these diseases. So a lot of physicians, most physicians use the U.S. Preventative Service Task Force, and we go by their recommendations. So when you go to the doctor and we're talking about, screening, you get questions that are asked to you, and you're like, well, why are they asking me this? Well, this is the reason why. So we're going to go through some of those right now. So infectious disease recommendations. It is recommended that screening for chlamydia infection in all sexually active, pregnant and non-pregnant women ages 24 and younger, and in older non-pregnant women who are at increased risk. Okay. We also recommend that clinicians screen for HIV infections in adolescents and adults ages 15 to 65. So everyone between 15 and 65 needs to be screened for HIV. Okay, know your status. Younger adolescents and older adults who are at increased risk should also be screened. We also have recommendations that clinicians should screen all pregnant women. So if you're pregnant, you get screened for HIV these days, including those who present in labor, who are untested, and whose HIV status is unknown. So if you present to the hospital and you haven't had any prenatal care and you go into labor, they're going to test you for HIV because they need to know your status. We also recommend, the U.S. Preventative Service Task Force recommends high-intensity behavioral counseling to prevent STDs for all sexually active adolescents and for adults at increased risk for STIs. So if you bring your adolescent to me and she tells me that she's sexually active, then I'm definitely going to have some conversations with her about making sure she gets tested properly and that she's using the proper protection. Now let's talk about some depression screening. There is a recommendation that screening for major depressive disorder in adolescents aged 12 and above and adults when systems are in place to ensure accurate diagnosis and psychotherapy and follow-up is available. So as a primary care physician, if I'm going to screen an adolescent for depressive disorder, then of course I need to make sure that I have the systems in place to treat you, right? I hope you guys got your papers and pens because this is some good stuff, okay? We're getting into the breast screening, the breast cancer screening. So the recommendation is for yearly mammograms starting at the age of 40, okay? And to continue for as long as the woman is in good health. So at the age of 40, ladies, you got to have your mammograms yearly, every year. Boom, 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 get them, Okay. There's also a recommendation that clinical breast exams about every 3 years for women in their 20s and 30s, and then every year for women over 40. And when I say a clinical breast exam, that means you've gone into the doctor's office and you get your breast exam done by your physician at least every 3 years. Okay. And then yearly after the age of 40. Some interesting facts that you may not know is that women who have family members with breast cancer, ovarian cancer, fallopian tube, or peritoneal cancer should be screened to see if there's an increased risk of carrying the BRCA mutation. Okay, so the BRCA mutation is what's called the breast cancer susceptibility gene. So if you have a first-degree relative that has breast cancer or ovarian, fallopian tube, or peritoneal cancer, then you may be at risk for carrying this BRCA gene. So it's recommended that you should get in-depth genetic counseling to review your family history. Okay. And then women whose family history is not associated with increased risk for the BRCA should not have that routine genetic counseling. So do not go to your doctor, ladies, saying, you know what? I had a mammogram, it was negative. I don't have any family history of breast cancer, but I want the BRCA screening. No, it doesn't work like that. Okay. So if you have a family member that does have a history of breast cancer, then you want to go ahead and get that genetic screening. Cervical cancer screening. There's a lot of confusion these days about cervical cancer screening. The recommendations have just recently changed. So now the new recommendation is that cervical cancer in women ages 21 to 65 should be tested by Pap smear every 3 years. Okay. And then for women ages 30 to 65 who want to kind of lengthen that screening interval, they could have a combination of the Pap smear plus the HPV, which is the human papillomavirus testing every 5 years. Okay, so let's see if that makes sense. So women aged 21 to 65 can get a Pap every 3 years, right? Age 30 to 65 can have the combination Pap plus the HPV testing. And if that comes out negative, they can lengthen their time to every 5 years. Now, we all know that HPV is the virus that causes cervical cancer. And there's a whole nother show that I want to do talking about HPV vaccination, because there has been some controversy and questions and myths and all types of interesting discussions regarding whether you should vaccinate your child against HPV. So we'll have that discussion. I'll have an expert in the field come do that for you. Now, for those older women who have had, or even younger women who, for whatever reason, have had a hysterectomy and you have had your cervix removed, and you do not have a history of a high-grade precancerous lesion or cervical cancer, we do not need to screen you anymore for cervical cancer. So no more Pap smears for you. Just a little tidbit for those of you who did not know. Let's move on to colorectal screening. Everybody has heard of the colonoscopy, right? And usually starting at the age of 50 and continuing until the age of 75, it's recommended that you get colorectal cancer screening done at least once, okay? So there are different colorectal cancer screening tests. A lot of people have heard of the colonoscopy, right? So there are actually other tests that you can do that is not as invasive, and you may be more willing to go in and get these done. There is a recommendation that you can use the fecal occult blood testing, a sigmoidoscopy, or the colonoscopy. But there are different time intervals for each one. So if you decide to go with the fecal occult blood test, which is also called a FOBT, it checks for hidden blood in 3 consecutive stool samples, and this should be done at least yearly. Okay, so you need 3 consecutive stool samples. The fecal occult blood test tests for blood in those samples, and it should be done every year starting at the age of 50. You can also have what's called the flexible sigmoidoscopy, where physicians use a flexible lighted tube to look into the interior walls of the rectum and part of the colon. This should be done every 5 years, but this should be done in conjunction with the fecal occult blood test every 3 years. Okay, so this one is a little bit more complicated, but you can spread it out to 5 years. So flexible sigmoidoscopy every 5 years in conjunction with the fecal blood test every 3 years. Okay, and then you have the colonoscopy. Right, so the colonoscopy is another flexible lighted tube, but it actually goes through the entire colon. The flexible sigmoidoscopy stops at a certain point. Okay, the colonoscopy does the entire colon, and this one is done every 10 years. Okay, if they find anything wrong, if they find a polyp, if they find they want to sample some tissue, they can take those and they can remove them. So if they do find polyps, if they do need to do closer examination, then the follow-up is usually 3 to 5 years after that. And then the colonoscopy also could be used, for instance, if the fecal blood test is abnormal, or the flexible sigmoidoscopy is abnormal. Now we can go to the colonoscopy as a diagnostic test instead. I hope you guys are getting some good information. So let's talk about these smokers. There are a couple of screenings that we do for smokers. There is the USPS, the task force. They recommend one-time screening for what's called an abdominal aortic aneurysm by ultrasound in men 65 to 75 years who have ever smoked. It doesn't matter if you smoked for 20 years, 10 years, 5 years. If you've ever smoked and you're a gentleman, 65 years to 75 years old, then you want to get this done at least once. And the rationale behind that is approximately 2/3 of people who have what's called an aortic dissection are male. So your aorta is the large artery that carries blood from the heart to the rest of your body. Okay, and sometimes you can have what's called like a balloon-like bulge in the aorta, which is called an aortic aneurysm, and that can sometimes dissect. So a portion of it can split in two, or it can completely rupture, and you can die from this. So diseases that, kind of damage your heart and your blood pressure and your blood vessels and increase your risk for this aortic aneurysm is high blood pressure, high cholesterol, arterial sclerosis, and smoking. Okay, so anybody 65 to 75 who has ever smoked, tell your grandpa, tell your grandpa, hey, have you ever had an ultrasound? You sound real smart. Have you ever had an ultrasound of your abdominal aortic aorta? Have you ever had that, Grandpa? Then you sound like you know some stuff, because you do, because you've been listening to the Diva MD Show. Hello. All right, so let's also talk about obesity. Obesity is my nemesis. It is a serious epidemic, especially in America. More than 1/3 of American adults are now obese. And the definition of obese is a BMI 30 or greater. So your BMI is a measurement of pretty much your height and your weight. They take the calculation, do some multiplication and some dividing, and they come up with a number that's standard for everyone based on their height and their weight. And just to give you an idea, a healthy weight is a BMI 18.5 to 24.9. So roughly 18 to 25. Overweight is 25 to 30, and obese is 30 or greater. Okay, so when you are obese, you are more likely to develop heart disease, diabetes, some cancers, and you have a likely chance of dying early. Losing weight can actually reduce the risk for illnesses and early death and improve pretty much your overall health. So it's very important that we take this very seriously. The U.S. task force, they actually recommend screening all adults for obesity. All adults. No one gets left behind in this. Clinicians should offer and refer patients with a BMI of 30 or higher to intensive multi-component behavioral interventions. So anyone who has a BMI greater than 30, go to your doctor. Ask them. You know what? They put you on a scale every time you go. Right? They measure your height every time you go. Ask them, what is my BMI? So you can get a good grasp of where you are on this scale. Blood pressure screening. The U.S. task force recommends screening for high blood pressure in adults 18 and older. So every time you go to the doctor, right, they're putting that cuff on your arm. You're getting your blood pressure checked. You may not realize it, but that is a screening tool. Blood pressure is the force of blood pushing against your blood vessels. If the pressure rises and stays high over time, it's called hypertension. If it's not controlled, high blood pressure can cause a whole host of things: stroke, heart attack, kidney problems, heart failure, eye problems. And interestingly enough, most people with high blood pressure feel healthy and don't even have symptoms. I talked about this earlier. It's called the silent killer. So it's important that every time you go that they put that cuff on your arm to check to make sure that your blood pressure is not high. Now, let's say your blood pressure is high. Now we're talking about going into diabetic screening. Many people don't understand the correlation between diabetes and high blood pressure. So there's an actual recommendation that screening for type 2 diabetes in asymptomatic, meaning adults that have no symptoms with blood pressures that's sustained greater than 135 over 80. Now we all know normal is 120 over 80. Okay. If your blood pressure has been sustained 135 over 80, now you need to be screened for diabetes. And the reason why this is so important is that people who have high blood pressure have increased risk of more complications from diabetes. Okay, so blood pressure measurement is an important predictor of cardiovascular complications in people with type 2 diabetes. And there are actually 3 types of tests that we can use for screening diabetes. We have the fasting plasma glucose. So what happens is you go to the doctor, they take a little bottle of sugar, they make you drink it, okay? And then 2 hours later, I'm sorry, that's the 2 hour. Please forgive me. The fasting is you haven't eaten for 8 to 12 hours, and they take your blood sugar and they see where it is. If it's greater than 126, then you have a diagnosis of diabetes. If it is repeated on a separate day and it's still higher than 126. Now, the 2 hour post-load plasma glucose is they make you drink a little sugar, and then they test your blood sugar 2 hours after you've drunk this sugary drink, and see what your blood glucose is. If it's elevated, then you have a diagnosis of diabetes. Then there's also the hemoglobin A1C, which all diabetics should even know. They should know their hemoglobin A1C. Your hemoglobin A1C measures your blood glucose over a 3-month period of time. Okay, so it's not just that, 2 hours after you've had, something sugary to drink, and it's not just, your fasting plasma. It is over a 3-month period of time. So they can tell what you've been eating over the past 3 months. And what happens is your red blood cells get coated with sugar. If there's too much sugar in your blood, your red blood cells get coated with sugar. And that number tells us, whether you have diabetes or not. So any number above 6.5 is a diagnosis of diabetes. Okay, so it's very important that you guys get tested. And then let's talk about these multivitamins, okay? Multivitamins are great. They replenish, some of the nutrients that you may not have gotten, through the poor diet that we all sometimes consume. But the U.S. Task Force actually found, for those people who were interested in prevention of cardiovascular disease and cancer, that there was no sufficient evidence to balance the benefits and harms of the use of multivitamins for prevention of these. So yes, you can take them. Yes, multivitamins are great, but if you're expecting it to help prevent cardiovascular disease or cancer, you might be a little disappointed. Okay. There is one more thing before we go to break that I wanted to talk about as well, is osteoporosis screening. We also want to screen for osteoporosis in women aged 65 and older, and actually in younger women who has a fracture risk that is equal or greater to that of the 65-year-old white woman who has no additional risk factors. So if you're 65 and older, you need to get screened by a bone scan. It's called a DEXA scan, and they go in and they give you what's called a Z-score, and it tells you, if you are at risk for osteoporosis or on your way to osteoporosis, which is osteopenia. Okay, so make sure that you are taking your vitamin D and your calcium, ladies, to make sure that you have strong bones and strong and strong bones. We are also going to talk about immunizations. Actually, we're going to hold that off for another show. Immunizations is an entire lecture on its own. So many different recommendations for, the influenza virus, pneumococcal, tetanus, herpes zoster, which is the shingle vaccine. So we'll get into that at the next segment or the next show. Thank you guys so much. I hope you had your pen and paper and you got some good information on how to prevent some of these diseases. And I will talk to you guys after the break. This is the Diva MD Show.
The Voice of Praise Battle and Concert Weekend is going down May 23rd through 25th, 2014 at the Met, 41st and King Drive in Chicago. We are looking for the top 15 soloists and choirs to be number one in their category. Win $1,000, a trophy, and a free recording session at UBN Recording Studios on Friday, May 23rd. Come watch the city's top soloists battle it out and enjoy a performance by Grammy Award winner Darius Brooks. Saturday, May 24th, let the top 15 choirs put you in the spirit while being entertained by gospel hip-hop giants Gemstones. Our grand finale on Sunday, May 25th will be a night to remember as Walt Whitman of Soul Children of Chicago takes center stage. Also a performance by Kim Stranton. That's right, thousands of dollars to be given away for the winners of the Voice of Praise Battle and Concert Weekend, May 23rd through 25th. Sponsored by Urban Ministries Incorporated, Attorney Ernesto Borges, Inner City Underwriters, City Colleges of Chicago, and PNC Bank. To order tickets or register for the competition, log on to urbanbroadcastmedia.com.
Doesn't it seem like our society is dominated by social media, gang violence, and a failing economy? Our family structures are deteriorating. Enrichment Parent and Child Center's mission is to provide a safe environment for at-risk families. Our enrichment and empowerment seminars focus on life and parenting skills. Knowledge is power. When you know better, you do better. Visit our website, www.enrichmentpcc.org. Click Donate to join the movement.
Hello, this is Leon Finney, your host of Another Perspective on UrbanBroadcastMedia.com. We are the voice of Black America. Join me and my guests every Saturday from 4 to 5 p.m. as we discuss the issues that impact Black America. Tune in to UBM Talk on UrbanBroadcastMedia.com, the simulcast on our affiliate station WBON 1690 AM. That's Another Perspective every Saturday from 4 to 5 p.m. and you can run and tell that.
Hey, Tanya, I need to get this report from you. You look upset.
Yeah, I just got a call from the school. My son is sick. Now I have to take off from work and sit in the doctor's office. It's so frustrating because we sit there for hours without being seen.
Sorry to hear that. You should consider DivaMD Concierge Services. They have physicians to come to your own home at your own convenience. I always get the VIP service.
Really?
Yes, and as stressed as you look, you could sure take advantage of their mobile spa services too.
Oh, that sounds great.
Yes, girl, they have licensed professionals to do massage therapy, facials, and waxing, all in the comfort of your own home.
Meaning they'll travel to me? Oh, I need that number right now.
Their number is easy, 866-8-DIVINE or 866-834-8463. Or even check out their website, www.divinemdconcierge.com.
Thank you so much. I'm going to call them right now and make an appointment for today.
Now about those reports.
Urban Broadcast Media, proudly broadcasting from studios located in the Bronzeville community in the city of Chicago. Heard around the world at urbanbroadcastmedia.com. UBM Talk, servicing the community and beyond.
Hey, this is Dr. Shanika Williams here on UrbanBroadcastMedia.com, UBM Talk, the Diva MD Show. I am so excited to have my own esthetician. Oh, I love her. China Thomas here to join us. She's going to talk to us about, when I say I mean Divine Aesthetics Med Spa and Wellness Center, located at 4753 North Broadway, Suite 514, Chicago, Illinois, 60640. call 866-8-DIVINE to make an appointment. But she is here to talk to you guys about skincare. Hey, China girl.
Hi, how are you?
I am well. Thank you so much for joining me today.
You're very welcome.
A lot of people don't understand that the skin is the largest organ on the body.
Yes, it is.
But that is like the most that people neglect, right? You slap on a little lotion, you slap on a little, sunscreen, and they're ready to go about their day. So,
and some don't even use sunscreen.
You know what? Y'all play too much. Yeah, we need sunscreen too. Okay.
Yes, we do.
So, yes, China, please tell me a little bit about what you do and how did you become so passionate about skincare?
Right now, I do a few different things. I'm also a freelance makeup artist. I represent several different lines, as well as several different skincare lines inside of Whole Foods, like all natural skincare. Also working for you.
Hey.
As well as helping in regards to managing the spa and things of that nature. I do a lot of seminars. I do a lot of education. I educate team members when I go inside of these retail locations in regards to skincare, product knowledge, et cetera, things of that nature.
Sure.
And I've also just recently did a fashion show where in the intermission segment, between the models getting ready and coming out, I actually did an actual education on just skincare and makeup.
Oh, wow.
And believe it or not, most men actually had more questions than the women.
Wow.
They care too.
Is that right?
That is right. Because they can't wear makeup and things of that nature.
And they can't cover up.
Absolutely. So they care about their appearance as well. It's especially the men that's actually, from mid-30s on up. They care, and I have a lot more men clients more than women clients.
That's interesting.
In regards to skin.
That's exciting too, because it opens up an entire new market.
Yes, it does.
A lot of men, like you said, don't. Well, okay, I don't see it. I don't see them taking care of themselves. I don't see themselves in the mirror, primping and prepping, getting ready for their day.
Right.
But they're actually, this is what they do.
Yes, they care just as much, sometimes even more than women do. I have a lot of clients that are married couples, that the man would buy more of the skincare than the woman would buy. She wants, and usually when we were taught in aesthetic school, we were actually taught that give the man a more of a simple regimen versus the woman, because they're not going to do all of that, which is semi, true, but for the most part, they are coming along just as well as we are.
So when you say regimen, for a woman on the go, what type of simple regimens do you recommend?
Everyone needs to be cleansing, moisturizing, and exfoliating.
Okay.
Even people of color, and the main reason is that we have the most thicker skin than an actual Caucasian skin type. So we're actually turning over more skin cells, and we need to scuff off those dead skin cells so new skin cells come to the surface. And we're actually ignorant to that. We don't understand, and we fall victim to generational curses.
Generational curses. So let me speak on that just a little bit. This is actually the opposite. These are actually some of the generational blessings, because you hear the saying all the time, black don't crack. Right?
It cracks.
And then I see a beautiful, woman over 50, in the marketplace, and her skin is glowing and, just absolutely beautiful. And one of the things that I ask is, what do you do? What do you do? And one of the resounding answers that I get is, I drink water. I drink water all day.
Stay hydrated.
You have to stay hydrated.
But the flip side of drinking water, you can drink water all day long, but our bodies don't absorb water. You being a physician, you definitely would know that. We don't absorb water, so we need products actually to take as a supplement, as well as topically to bind the water to the skin, which is hyaluronic acid. So when you're purchasing like your serums and your moisturizers, make sure that you read the ingredients, that anything that says hydro in it, because that's what our bodies already naturally produce, and as we age it starts to diminish. And what it does is it binds the water to the skin and it plumps up any type of fine lines if you take it topically. If you're taking it as a supplement, it's going to bind the water and lubricate the bones and the joints. So it's actually prevention against any type of arthritis as well.
Sure. So let me ask you this. There are many times when people who, let's go into makeup right now.
Okay.
Right. So young ladies, I don't wear makeup myself. I never have. It's not that I'm not interested. I just don't know how to apply. And that may be some issues that a lot of women are having, that, you know, even if they do wear makeup, it may not be tasteful. So what types of tips do you have for makeup application?
Well, first I would like to say, for the women who say that they do not wear makeup, if you wear eyeliner, mascara, anything of that nature, you're wearing makeup. You may not contour or take a lot of time, such as myself, because I'm more so interested in the whole artistry aspect of it, but you are wearing makeup. Simple as that.
Well, I don't wear any of that.
You sure don't. So but that's okay. You have very beautiful skin and you take care of yourself. So, but the ignorance of it is that I get a lot of women who say, oh, foundation ages your skin. That's untrue. Actually, foundation is a benefit. It helps it helps to protect your skin and prevent any type of free radical damage. That's any type of environmental aggressors. We live in Chicago.
Absolutely.
This is the city of pollution in general. So it's actually protecting your skin. Even if you haven't worn sunscreen your entire life, or have any knowledge of wearing sunscreen, it's actually protecting your skin against, not to the point where sunscreen is protecting against the ultraviolet rays, but it is giving it some type of protection.
Okay. And then let me ask you this. For the average woman, okay, who does not have a cabinet full of products, and I think that was part of my issue too. Like, I'm not a product person. So what are some of your kind of inexpensive tips for women who may not want to have, you know, the top line, you know, skincare product, but still wants to have good results? You know, what type of options do you recommend for them?
So if a woman just wants just something where they can just put on and actually look natural and still going to protect their skin and give them a little bit of enhancement, because that's really all what makeup is it's just enhancing your natural beauty of what you already have.
Not covering up, but
not
enhancing.
Covering. Absolutely. I'm a very big advocate on actually taking care of the skin inside and out. But on the flip side of that, if you don't take care of your skin, the makeup isn't going to lay as pretty as you like. So you just want it to enhance. So you're not going to have that flawless finish as you would want if your skin isn't well taken care of and if you do not have healthy skin.
Okay.
So don't cover up any type of acne scarring or hyperpigmentation. You want to correct that. So one thing that they have on the market today is called a CC cream, and that's called a corrective cream.
Okay.
Well, actually, it stands for corrective cream. And what it's going to do is it's not going to only conceal, but it's going to correct. So it's going to be used as a tinted moisturizer, but it's going to help to even out the skin tone. It's going to help to brighten up any type of dark spots, as well as has SPF inside of it, which is going to protect you from the sun.
Sure.
So it can actually be your base in regards to foundation, as well as your moisturizer, as well as your serum, because it has vitamin C inside of it. Vitamin C is a natural skin brightener, and what that does is it evens out the skin tone.
So if I just take vitamin C?
No.
Oh, okay. So, clarify for me now.
So you want to make sure, and no, don't get any type of vitamin C tablets and open it up and put it on your skin. You want to make sure you're getting it in a serum form, preferably something that has a stem cell to it. Stem cells is what our bodies already have, and the skin actually recognizes it. It's fastly absorbing to give you more visual and effective results.
This is why I hired you, girl. Y'all hear her? I love it. I love it. So, to you, why is it important to even take care of your skin in the first place?
Well, someone who, such as myself, who has a lot of pigment to their skin, of a dark skin tone, actually, wearing SPF is actually more important for me to wear it than anyone else. Only because a great explanation of that is if you're wearing all black in the summertime, the sun is more absorbent to the color. So it's going to be more drawn to that pigment in my skin. My skin is going to naturally try to heal itself. And when doing so, it creates the overproduction of the melanin, which determines my skin tone, and it causes hyperpigmentation. So I will be like 3 or 4 different colors. Just simply because I haven't taken care of my skin.
Sure. So what tips do you have for ladies this summer?
This summer, making sure that, that CC cream is great. If you want a foundation, it's going to have everything that you need in it in regards to helping act as a skincare regimen for you, as well as concealing and giving you more of a flawless finish, as well as protecting your skin from the sun. Don't wear it out night to the club because it does have SPF inside of it. So if they take a picture in that flash, you're going to look ghostly. So you do need.
Yeah, wait, please repeat that for them.
So you don't want to wear a foundation with SPF inside of it for photo shoots and things of that nature. So if you're going out a night on a town, you want to make sure you have a separate foundation because SPF is going to offset the flash and it makes you look ashy.
Interesting.
Ghostly.
Now I'm going to scroll through my Facebook pages and my Instagrams and see who has ashy faces on their nightclub photos.
And YouTube should be your best friend. There's a lot of makeup artists that's on YouTube, just people in general that try different types of products, and they actually do a nice little analysis on it on YouTube. They give you a lot of tips and tricks in regards to how to contour. What do you mean by contour? Contouring is actually making your cheekbones look a little more chiseled. Okay. Giving them a little bit more chiseled look. Some people actually have naturally high cheekbones and they don't have to do much contouring. But say, for example, us women, we retain a lot of water from time to time and we may look a little puffy. So contouring comes in hand. Sure. During those times.
Okay. And then let me ask you this. How often should a woman or man come in for, say, facials? For maintenance care. For maintenance, I believe that they should come in at least once a month. Every 4 weeks. Okay. And what does that do? Well, it's going to help to give more circulation to the skin. It's actually it's a relaxation. We would do extractions. What extraction is getting out any type of oil to helping the pore to actually close up. What the pore is, if you have enlarged pores, you naturally have oily skin. And that's a great thing to have oily skin because you'll have more youthful skin. But you want to balance out the oil that's in the skin because that's going to help to prevent and get any type of acne. Things of that nature. And what about individuals that have acne? Because sometimes you can get acne as an adult. What are your recommendations for? A lot of the times, adult acne is more hormonal acne. So anything below the cheekbone area, that's considered hormonal acne. So you want to actually look into balancing out your hormones better. But you can prevent it before it starts. How so? By taking care of your skin, watching your diet. Back to the same preventative care that we kind of discussed a little bit earlier. Okay. Yes. Taking care of your, making sure that you have a healthy diet, making sure that you're drinking enough water, that you're not dehydrated. By the way, dehydration, there's 2 different types of skins. Dry skin is a lack of oil. Dehydrated skin is a lack of moisture. So for people who have oily skin and they're like, I don't moisturize my skin. Well, you should, because you're creating a dehydration in your skin. If your skin becomes dehydrated, it's going to produce more oil to overcompensate for the fact that it's dehydrated, and then you're back to square one when it comes down to acne. That makes sense. You have more acne-prone skin. That's just how the skin works. It's an organ. People don't understand that. It's an organ. The largest organ in your body. But it's the most neglected, and it's really due to ignorance. Well, I am so glad that you are here to educate our listeners. If they wanted to look you up, China, where could they find you? Facebook, China N. Thomas, as well as Instagram, China_esthetician MUA. Say it one more time.
China_esthetician MUA.
All right. Thank you. So let me ask you some other questions before I get you out of here, because I still got a few more minutes to hang out with you, and I'm excited about that. So what do you recommend? What is the youngest that you've ever treated or recommend to start getting facials?
13.
Okay. And why 13?
Because that's when, as you know, the hormones are actually the most imbalanced. And you start them off young in regards to taking care of their skin. A lot of people say, they'll come into me and they'll say, I'll ask them, tell me a little bit about your skin. What have you been doing? Almost 90% of everyone says, well, I wash my face with water. What? Hot water at that.
No. No.
Yes.
So what should they do? Please school them.
Then they'll say things like, well, I've washed my face with bar soap.
Which will dry you out.
Dry your skin out, and it causes a film. So it's actually, you're putting more oil back into your skin, so to speak. And you're drying it out, so it has no moisture, and you're putting more oil back into it.
Which can make you prone to acne.
So starting them out as young as 13 in regards to actually having a cleanser, knowing their skin type, knowing that they may be just oily. They may have combination skin. They just may be oily in just like their T-zone areas.
T-zone meaning?
Meaning your forehead, your nose, and your chin area.
Okay.
If you have more larger pores around your cheekbone areas, we know that you have more oilier skin. And the pores on the face need to breathe. So you want to make sure that you're not using anything that's comedogenic, that's going to clog the pores.
Which means you can develop acne.
That's it. I mean, it all kind of ties in together. And when you develop acne, you're going to develop acne scarring. And that's where the blemishes and things of that nature come into play.
So I know people, I'm not going to say I did it myself, who pop their pimples.
Don't do that.
Is that good or bad? What's the recommendation?
That is bad. Do not pop your pimples.
Stop popping your pimples, people.
That's what I am for. That's where I'm taught and trained to extract your pimples so that the blood vessels beneath the skin do not burst and do not cause any type of scarring. So that whatever is in there, we're going to properly get it out. And we're going to make sure that it doesn't seep into the rest of your pores.
Sure. What about patients that have sensitive skin?
So everyone doesn't have sensitive skin. People who think they have sensitive skin don't have sensitive skin. Sensitive skin is actually it's a condition that's developed over time due to misuse of products. If you have sensitive skin, every part of your body is going to be sensitive, meaning that you're going to you have to use a special detergent. You can't wear certain type of fabrics, things of that nature. You can't eat certain things because your skin is sensitive. Everyone doesn't have sensitive skin. People come in, oh, my skin is so sensitive. I can't put this on my... No, did you wash your face?
That's the bottom line.
What have you been cleansing your skin with over the past 5 years?
Is that the bottom line? So those people who actually have sensitive skin, that
they would know
1%, what are your recommendations?
Usually those are like rosacea clients, things of that nature. They want to pretty much deal with things that's all natural. When they're shopping for their makeup, they want to make sure that it has like a green or yellow tone to it, because green and yellow actually offsets redness. They want to make sure that there's products in it like sandalwood, things of that nature, that's going to help to heal the weakened capillaries beneath the surface of the skin. Don't smoke. Don't eat spicy foods. Careful in your alcohol intake. Those are all things that's going to aggravate sensitive skin and the broken capillaries as well.
And you can also use those recommendations for just maintaining good, healthy skin, period.
Absolutely. And with sensitive skin, usually they're going to want, it's very dry, it's very red. You can even see the redness in people of color, in pigmented skin. No matter what your skin tone is, you're going to be able to see that. And whatever you put on your skin is going to burn or tingle a little bit. and it shouldn't. Healthy skin should be acidic and slightly moist.
Okay.
A healthy inside of your body should actually be alkaline. So that's the difference. So you want to make sure that you're
Science to this, folks. It's a science.
putting moisture, consistently putting moisture. If you buy any type of mask that that has hydration to it, you can actually sleep in those masks overnight to put the moisture into your skin. That's another thing. Make sure that you're putting moisturizer on your skin while you're resting. We lose the most moisture at night. Moisture. I can't say it enough. Okay. That's what's going to help prevent any type of, as far as anti-aging, as well as people with skin sensitivities.
So how do you choose a mask?
Well, it all depends on what you're trying to do. So if you want a moisturizing mask or something that's going to be hydration, it would say it, and it would be more of a gel base. Mud mask, those are things that's drawing impurities out, not necessarily going to be exfoliating. Okay. Peels are actually exfoliating. Anything that says enzyme is going to be exfoliating. Okay. So pumpkin, if it's a pumpkin peel, that's an enzyme. So it's going to naturally exfoliate and get rid of any type of dead skin cells and help to bring the new skin cells to the surface. Okay.
So if you guys have been listening, you've been listening to China Thomas. She's from Divine Aesthetics Med Spa and Wellness Center, located at 4753 North Broadway, Suite 514. Call 866-8-DIVINE to make an appointment. You guys know Mother's Day is around the corner. If you haven't gotten your Mother's Day gift yet, this is definitely something that you may want to consider. This could be something that becomes a monthly venture for you and your mom to come, get beautiful radiant skin on a regular basis and learn how to keep your skin healthy. You can find China at
Instagram, China_esthetician MUA, Facebook, China N Thomas.
And you can also find me at DivaMD929 on Instagram and Twitter. You can also go to DivaMD.discoveryourself on Facebook. And, if you guys still have questions, if you want questions answered, I'm definitely can get to China to get those questions answered for you. So feel free to drop us a line or two on Facebook, Instagram, and Twitter. Now, on a whole nother note, you understand that DIVA is an acronym for Discovering Your Innermost Valuable Assets. What do you think is your most valuable asset? I'm putting you on the spot. I love it.
My most valuable asset is that although people say that no one's perfect, but I strive for perfection by being true and honest with myself.
I love that. Thank you so much, China. I really appreciate you coming and hanging out with me on the Diva MD Show.
My pleasure.
You can come back anytime.
Yes,
ma'am. I gotta pay you when you come. Okay, no, that's a whole other story. So again, if you want to find China, you can hit her up at China_esthetician MUA on Instagram and Twitter. And you can find Diva MD 929 on Instagram and Twitter, Facebook, DivaMD.discoveryourself. Please send in those questions. If you have any questions about any of the preventative care that I talked about earlier, colorectal cancer screening, mammograms, anything that you want to talk about, feel free to hit me up and we'll chat. I am so glad that you guys spent the time with me today, and I hope you have a wonderful, wonderful week, and I will talk to you again, same time, same place, at the Diva MD Show. Thank you so much, and she's out.
of Praise Battle and Concert Weekend is going down May 23rd through 25th, 2014 at the Met, 41st and King Drive in Chicago. We are looking for the top 15 soloists and choirs to be number one in their category. Win $1,000, a trophy, and a free recording session at UBM Recording Studios on Friday, May 23rd. Come watch the city's top soloists battle it out, then enjoy a performance by Grammy Award winner Darius Brooks. Saturday, May 24th, let the top 15 choirs put you in the spirit while being entertained by gospel hip-hop giants Gemstones. Our grand finale on Sunday, May 25th will be a night to remember as Walt Whitman of Soul Children of Chicago takes center stage. Also, a performance by Kim Stranton. That's right, thousands of dollars to be given away for the winners of the Voice of Praise Battle and Concert Weekend, May 23rd through 25th. Sponsored by Urban Ministries Incorporated, Attorney Ernesto Borges, Inner City Underwriters, City Colleges of Chicago, and PNC Bank. To order tickets or register for the competition,
log on to urbanbroadcastmedia.com.